Aloha mai kākou, and welcome to the 9th Kaʻiulani Center for Sustainable Island Food Systems Brown Bag Speaker Series event addressing the topic of food as medicine. I'm Ioane, and on behalf of the center, I want to mahalo all of our guests and presenters for taking the time to attend today. Please scan the QR code in the bottom left corner of the current slide to see previous events that we've hosted on our new webpage under the Brown Bag Speaker Series tab. And stay tuned for the recording of this event, which will be posted on our page, and the YouTube link that'll be sent out to all the registered guests within a few days. I'll be posting links within the chat so you can access that page along with all of our panelists' relevant content as we go through these presentations. So the speaker series here is just one of the projects that we're working on at the Kaʻiulani Center, which is an initiative within the UH system co-directed by both Dr. Albie Miles and Dr. Noel. One of our main objectives here is to collaborate with folks at UH and across the entire food systems landscape in Hawaiʻi to highlight the work being done by different individuals and organizations with the goal of improving our local food system. This includes addressing topics such as food security, justice and equity within the food system, ecological sustainability, and food system policy. Oftentimes we find this work is being conducted without much public visibility. So we're here trying to make connections by building and maintaining these important relationships, and then sharing the work being done by these individuals and organizations with the people who it is significantly affecting. So overall, we just want to better identify what the university can do to support and improve food systems transformation in Hawaii. In addition to hosting events like this, the Kaʻiulani Center has been established to engage in a number of other activities to include research, data collection, education, community engagement, policy analysis, and varying monitoring activities. The intention here is really just to better measure and realize food sustainability goals by creating and maintaining the social, intellectual, economic, and political spaces that we feel are necessary to drive systemic change in a forward direction for Hawaii's food system. You can learn more about the center and see some of our past and current projects dedicated to this work on our Kaʻiulani Center website, which I'll post the link for as we get moving here. A few housekeeping tips for today. All the audience interaction is limited to the Q&A feature within the Zoom platform, so please feel free to write your questions as they occur to you, and any questions not addressed within the allotted time will be answered via email from our panelist guests following the event's conclusion. Our guest today will be discussing food as medicine and the CMS Section 1115 waiver for health-related social needs relating to access to nutritious foods. I'm really excited to introduce our panelists. Today, we're welcoming the Executive Director of the Hawaii Good Food Alliance, Kaʻiulani Odom, the ʻAiaola Food as Medicine Program Manager, Jordan Smith, and the Roots Program Director at Kōkua, Kalihi Valley, Jesse Lipman. So, Kaʻiu, if you would please start us off after I stop sharing my screen here.
Yes, I'd be happy to. Aloha, everybody. Welcome to today's presentation. Jordan, you want to start the slideshow? Okay, so we're going to be talking a little bit about food as medicine. And every time I hear this, I just really have to say my work throughout my whole life has been food as medicine. And for, what Jordan does and Jesse does, we've been working with the health systems and food systems, combining them, and that we've always known that eating healthy is good for our body. But anyway, now it's got a title that's gaining traction, so we're happy about that. And we want to talk a little bit about some of the work that's going on here in Hawaii when we're talking about this work. And so I'm Executive Director of Hawaii Good Food Alliance. Food as medicine is just one of our pathways. And then you see Jordan, who's also our ʻAiaola Food as Medicine Program Manager, and Jesse Lipman. And Jesse and I actually worked together for a long time at Roots. And we started a program where just 3 of us, and it expanded into, I think there's almost 15 people there now, but 2 community gardens, a cafe, a food hub. We had our ʻAiaola Family Health Program, our birthing program, the mobile food truck you guys might have seen around town. And so Jesse's now leading in charge of that, but we have all worked together in some way or another and are very supportive of each other's work. Next slide. That's me. But besides being the executive director, I'm a mom, I'm a grandma, I'm a great grandma, I'm a kumuhula, I'm a practitioner of Hawaiian healing medicines. But most of all, I'm really passionate about our community here in Hawaii, our lahui, and that we are thriving for all of our future generations, and not just us as people, but our land, our community, and all of the institutions that we have here. So we're going to talk about kind of some of the work that we're doing towards that end. Okay. So Hawaii Good Food Alliance, just for a little bit of a background, is comprised of 8 organizations. We started off with 10, but we're down to 8. And so they're across the state of Hawaii. On Oahu, we have Roots, KKV, where Jesse will be talking about his work. Ma'o Organic Farms, Waianae Coast Comprehensive Center, and specifically Elapaio Services, and Kahumana. On Molokaʻi, we have Sustainable Molokaʻi. Big Island, we have the Food Basket and the Kohala Center. And on Maui, we have Maui Food Bank. And we gathered together starting in about 2012, just on our own. Tina Tamai actually was the impetus that got us all together, but we've been gathering for over 10 years just to come together, support each other, talk about the food system. And we represent farmers, we represent practitioners, we represent producers, we represent several federally qualified health centers. So we're running the gamut, food bank, and we come together and talk and discuss what's going on and use our collective power for good. And so in 2020, we formed a nonprofit, and this was right before COVID. So through COVID, it was just about supporting the Alliance and making sure we all knew what was going on. And we ended up, as COVID was ending, we got a RFBC, which is a Regional Food Business Center grant. And this is a grant to help producers and farmers get their product to market. And we not only are here in Hawaii, but we were given all the non-contiguous states and territory of the United States. So American Samoa, Alaska, Guam, Saipan, Northern Marianas, Puerto Rico, St. Croix, St. Thomas, and did I say American Samoa? Anyway, those are the regions that we're helping on this 5-year project. We have the bucks that we're in partnership with the Food Basket, and so doubling up the amount of money so people's dollars go farther when they're buying local produce. We have our Food is Medicine, which is what we're talking about. The Hawaii Food Hub Hui, an alliance of 15 food hubs that come together to unify and do projects. Right now, one of our projects we just were awarded at the end of December was to distribute 58,000 food boxes across 45 zip codes within 5 months, and all produce and protein would need to be purchased from our local farmers. So that's 3.5 million that's going back into our farming community. And Hawaii Farmers Market Association, we're actively working on trying to get WIC into more of our farmer market and food hub. Thank you. These are our good food pillars. So everyone that we are involved with, we are grounded in this type of work, and also organizations that we choose to work with. We want them to be culturally grounded, respectful of all of the values that are here in Hawaii. Food is medicine, understanding that we are going for the healthiest food for our bodies, that, and it's a spectrum, but we want to understand that we want everyone to be working towards the fact that what we put in our bodies will be good for our health. Equitable, community-based, and making sure that our land is the most important. We believe that if we made decisions on what was best for the land instead of what was best for the pocketbook, that we'd be in a much different situation than we are now. And so caring for the land is one of the strongest pillars that we have. Food is medicine just reflects the connection between food, Ioane, and health. Excuse me, that historically, before colonization, we fed over 800,000 to 1 million people without any outside help. And now we're importing 85% of our food. So what can we do to change these statistics? And I apologize. I caught a cold this weekend and I'm trying to get over it. Food is medicine. This is the pyramid that you will often see. Excuse me. At the top are really all of the medical interventions that you think of, your produce and prescription box, your medical meals, the SNAP assistance. What we've added are in the bottom, the darker green, is that as we go through food as medicine and as we get all of these um, medically tailored interventions out, that we can never forget that what we're trying to also do is create a circular economy that empowers our farmers and holds us accountable to our aina. So who will benefit? What is the benefits of this? Our healthcare workers, our populations with diet-related diseases, food insecure households, our farmers and food hubs. We want all the, there's like, I forget, Jordan has the statistics, 98 million or something like that, that can be put back into our local economy. We don't want it going to places like Instacart or, just you can order off of some store that isn't really going to be invested in making sure the money only goes to local. And what we're really invested in is that as we work through food as medicine, we want the money to stay within our aina, within our land, and then our aina and ecosystem. Our ʻAiaola Food is Medicine Center is something we're building at HGFA. We have several different pathways in it. The sustained funding for nutrition support services, which Jordan is going to talk a little bit more about, training and continuing medical education. And this is really because, I don't know if those of you know, but for much of our medical care system, there's not a lot of nutrition education that goes on in the training especially when you compare it to the amount of pharmaceutical training. And so quite often people that don't have that nutrition training, they will tend to use what training they have. And so what we want to make sure is that we're providing culturally grounded, nutrition-based education for the healthcare system that will help them to make informed choices when working with our population. And place-based evaluation and community of practice, we're hoping to develop within our center, especially evaluation processes that take into account who we are, where we come from, and what is important to us. So this is just one of the first trainings that we had, just to give you an idea of some of our cultural education stuff. And so we went up to Ho'oluaina and we had invited healthcare workers. We had them pull weeds in the Olena garden. That was the very first thing to do, to get acquainted with the aina. Then we had actually a researcher from UH come and talk about some of the research they've done on some of the medicinal plants here in Hawaii. We had them all cook a meal together with some of the plants that were mentioned so that they were building a meal off food as medicine, but really on the plants that were growing all around us. And then we did a la'au walk within the garden. And for many of our medical professionals, they had never actually been, this is what we did at Roots. This is what Jesse and I would do all the time. But many of them had not been to that, and they're really appreciative of it. And it was just some of the small things they took away. Like we talked about the 3 different picos that we believe in, and one being the one at the top of your head that connects you to your kupuna, your ancestors, and how we never hit in the head, or we don't do anything in that area because that is where our ancestors dwell. And I remember one pediatric nurse saying, wow, she's a pediatric doctor, I didn't know that. I that's really good information for me to know when I'm working with local families. So just little things like that people got out of it. I think in the end, if we can keep doing this kind of stuff, we'll go a far way in working with our local community. Here's everyone cooking together. They love the actual research. I think it was John Paul that did the presentation, but really wanting to know, what kind of components and how are they being used in all of our local la'au, our local medicine. And here's our chef. Here's everybody making a meal together. We believe there's a great mana in how you make a meal, what you say while you're making a meal, and just the effort that you do. And then when you feed everyone with it, that's helpful and it's healthful in itself. Yep. More of our meal. So this is our ʻAiaola. This is a series of 4 workshops based on our cultural knowledge and foundations around good food. And so we're having 4 this year. The first one was in Palehua. We just had our second one in Waiʻanae. The third one will be in Waimanalo and then in Kalihi. And then we're going to culminate with our bigger one at West Oahu at the beginning of Makahiki ceremony. But if you just look at the pictures, we started off with ceremony and protocol. All of them will start off with ceremony and protocol. There's a va'a there that accepts any gifts of food that people want to bring from their aina. We have not panels, but talking circles with different subjects and themes where there's a little bit of a presentation to start off the discussion, but then we discuss what's important to us as practitioners and food system workers. So this was the first one in Palehua. It's our opening circle. The limu guys were there, baking lei with limu. Next. Cooking all of our traditional foods, making sure that we're feeding people healthy. While they're in ʻAiaola, you want to be feeding them traditional food. Next. This is just some of our talking circles, in the forest, under a tent, believing, when you can get out of the 4 walls, you don't have the 4 walls right around you, is that your mind can also expand. And as you're sitting in nature or sitting amongst, or being grounded on the aina, that the conversations are different. This is our one in Waiʻanae. So Alicia Higa from Waiʻanae, Mario Neha from Waimanalo, myself, and Manu Myers from Palehua. Puni's missing inside here too. She was also part of the original organizing committee, which is why the AHAs are going to these different places. And if people might be interested in attending, we will take down names to send out for the next registration. Next. Okay, thank you, everybody.
Thanks, Kaʻiu. Excellent way to kick us off. Yes, echoing Jesse's round of applause. Hi, everyone. My name is Jordan Smith. I'm the Iola Food as Medicine Program Manager at HGFA. I'll be sharing about opportunities to expand and sustain locally sourced food as medicine and all the wonderful stuff that Kaʻiu just shared. And as you beautifully stated, this work has been rooted, right, and happening for generations in Native and Indigenous communities. And so over the last 10 years, there's been a huge push and movement in Western medicine to start addressing what they're calling health-related social needs. And so really focusing, right, the saying that 80% of your health happens outside of healthcare or outside of the doctor's office, and 20% happens inside. And so now really trying to focus on that 80%. So whether that's housing insecurity, food insecurity, transportation insecurity, personal safety, how can we start leveraging our healthcare and our health plans to address these types of needs and lower our healthcare utilization costs and improve life for our communities? And so an emerging opportunity, just one pathway to sustain and expand locally sourced food as medicine is around Medicaid. And this is an emerging opportunity for Hawaii specifically in terms of focusing on nutrition support services to leverage healthcare to, again, address those health-related social needs and support whole person care. And for anyone who's not knee-deep in Medicaid policy, Medicaid is a federal and state partnership that provides health coverage to eligible low-income children, adults, and other vulnerable populations. That partnership happens at the federal level with CMS, the Centers for Medicare and Medicaid Services, and is administered at the state level by our Department of Human Services MedQuest division. Medicaid has a huge impact here in Hawaii. As of January of last year, enrolling almost 500,000 people in the state, covering about 40% of keiki and 40% of adults in Hawaii, and 45% of keiki are Medicaid enrollees. There are 5 health plans across the state that administer Medicaid, and they received just upwards of $2 billion in the last fiscal year for covered medical services. And more than 50% of Medicaid enrollees are covered by just 2 of those health plans, being HMSA and Aloha Care. And so there's this temporary authority under Medicaid called the Section 1115 Demonstration Waiver, which you'll hear which you'll hear very frequently, and shorthand is the 1115. And so this is a temporary waiver that states can opt into to start to cover health-related social needs and better address whole person care, with the whole goal of improving health outcomes, right? And maintaining that managed care delivery to lower healthcare utilization costs and addressing those health-related social needs. And so this is a waiver that's renewed every 5 years. It's been renewed in Hawaii every 5 years since the mid-90s. And it's a long, arduous process that I won't get you in the details of, but it took upwards of 2 years to write this application and submit it and get its approval by CMS. And one of the health-related social needs that we're seeing across the state being addressed in these 1115 waivers is all around what they're calling nutrition support services and what we're referring to as food as medicine. And so I know folks have seen, I know Amy was on a couple webinars ago talking about the food insecurity report that the food bank did last year, which was incredibly informative. But we know now, right, the food insecurity needs that exist across our diverse populations, and that our current systems, our current federal nutrition assistance programs aren't meeting that need. And we've also seen a growing body of research really proving, right, that when you give folks access to locally grown, delicious, nutritious food, that it improves their health outcomes and well-being, whether that's A1C, right, whether that's the food insecurity risk, that we're really making important intentional impacts on people's lives. And in the last 10 years, there's been upwards of 15 states that have had their 1115 waiver approved by CMS to include nutrition support services. And so this is, again, a growing body of evidence and a huge movement nationally to fund this type of work. And so Hawaii submitted their 1115 waiver in February of last year of 2024, and specifically focusing on 4 services. So one is continuous eligibility for keiki. The second is nutrition supports, the food as medicine, which we'll be talking about today. Our Department of Human Services also included expansion of their community integration services, which would cover rental and utility assistance and other things around housing and security. And then also for the first time, authorizing pre-release coverage for Medicaid for up to 90 days before release for folks coming out of correctional facilities or youth facilities. And so, yeah, I don't know if DHS is here, but I just want to give them their huge kudos. This was a huge undertaking, and it's very clear that they were very intentional to think about all of the needs in our communities and what folks need to be healthy. And so as of January 8th of this year, Hawaii's Medicaid 1115 waiver was approved by CMS. And so these are the 4 nutrition support services that you'll see in that approval waiver, including nutrition education, nutrition prescriptions, which is the fruit and vegetable and protein boxes, home delivered meals or pantry restocking, and then also medically tailored meals. And additionally, cooking supplies and transportation to get to those services has also been included, and it's under a different funding authority that I won't get into the details of, but it's all included in the waiver. And Hawaii was the first state in the nation to include that quote that you see there at the bottom in our waiver language, that Hawaii will encourage the inclusion of local growers, community gardens, and other community-based organizations to support the purchase of locally grown food and strengthen Hawaii's intrinsic food system. So we were incredibly excited to see this language. As Kaʻiu shared, right, this work has been going on for a long time. And so we have a lot of knowledge and evidence-based practices to help make this vision become a reality. I'll go through this quickly. Won't try to get you too much into the details. And again, these next few slides are from the waiver application language, which was from 2024. And now that DHS has received that guidance from CMS, they now have to interpret it and create their own guidance. So this is just from what they said in the application that they want to be doing, and not necessarily what they're going to do, just in case DHS is on here and gets upset. We know that this is just an idea of what should happen. So in terms of nutrition education, looking at up to 12 sessions per 6 months period. And for all services, the eligibility, proposed eligibility would be for 6 months, and you would need to re-see your Medicaid provider to to renew that if needed. But nutrition education would include, right, things like food preparation, reading labels, and we're really excited that includes a gardening component. So growing food as nutrition education and to be reimbursed. The fruit and vegetable protein prescription boxes, those would be a weekly box. And it also includes supplies to grow food, not just the food itself. And it could be available through a mix of different funding mechanisms, whether that's a voucher, whether that's a direct box, a spendable card, whatever's really convenient for community. For meals and pantry restocking, that's healthy meals or groceries. And it also includes a one-time provision of cooking supplies that might be needed to prepare those items. And looking proposed for up to 3 meals per day, 7 days a week, or a monthly, right, grocery pantry restocking. And again, that could be a direct provision of food, a spendable card, a voucher, what's convenient for community. And then lastly, the medically tailored meals and groceries, very similar, right, to the healthy meals, but this one, it requires, right, that medically tailored meal plan from your Medicaid provider, but similarly would be up to 3 meals per day, 7 days a week, or a monthly restocking. And this was the proposed of who would be eligible now, right, for these types of services under Medicaid. And I forgot to say that, right, this is a 5-year demonstration pilot. So it's not necessarily going to be a statewide, right, everyone who's eligible could participate. And so DHS has to be very specific on who would be eligible for which kind of service. And this is their thinking about what that could look like. And so the 3 eligibility categories would be that medical appropriateness, you know, what a lot of folks might think of in terms of obesity, overweight, chronic disease, or cardiovascular risk. But then also looking at, right, the more expanded health-related social needs, whether that's lack of transportation, right, food insecurity, right, limited access to utilities, interpersonal violence, or other types of social needs. And then this last category would be major life transitions. So thinking postpartum, coming out of foster care or long-term care facility, folks that might need that extra support during a really pivotal transitional time. And now this is just those 2 slides smashed up against each other. And so we think of the 4 services and then who would be eligible based on those categories. And again, this has just been proposed in the application by the Department of Human Services. And you can think about our food is medicine pyramid. As we get higher up that pyramid, the criteria to be eligible gets a little more acute, right? So think about nutrition education, or the produce and protein prescription boxes are eligible, right, for anyone. Could be a medical need, could be a health-related social need, could be a major life transition. Now we think about meals or pantry restocking, right? It has to be a health-related social need. If you're pregnant or under 21, or it could be experiencing that life transition. And then again, with medically tailored meals, you need to be experiencing a combination, right, of medical need, a health-related social need, or that major life transition. A very exciting part of the waiver that is coming down as well is CMS and, right, Department of Human Services recognize that in order to make, right, housing supports happen, nutrition supports happen, they have to partner with what they call, right, non-traditional healthcare partners. So food banks, food hubs, community-based organizations that are doing this work, but don't necessarily interact with the healthcare system, receive reimbursement, or anything like that. And so as a part of the waiver, they include infrastructure and capacity building funding for community-based organizations to scale up in order to meet the demand and implement these types of services. And so there is about $76 million available over 5 years and across those 4 services that I showed on a couple slides ago. So it is a lot of money, but it starts to dwindle down, right, once you start dispersing it. But thinking about what types of infrastructure and capacity will community-based organizations need, or local farmers and producers need in order to engage in this locally sourced food as medicine expansion. And so the 4 categories that could fall into that include technology, development of businesses or operational practices, workforce development, and outreach education and convening. And so this slide is just kind of to represent the different stakeholders that are in play right now, and that are going to have to, right, come together, many for the first time, to start building relationships and making connections in order to make nutrition supports happen. And so thinking about across all these services, all of these different type of provider network types of nutrition support providers, what types of infrastructure and capacity building are needed to scale up and meet this exciting demand. And if we are successful with this locally sourced food as medicine expansion, we hope to see really significant impacts in multiple parts of our community. One, as I mentioned earlier, the food bank study finding that nearly 1 in 3 households in Hawaii are food insecure, and showing that our current nutrition assistance programs, right, are not sufficient to meet community need. And so by opening up this new avenue through Medicaid, being able to address that public health crisis head on. Second, with just kind of approximations of numbers that were included in the 1115 application waiver, we could be seeing upwards of $100 million available for reimbursable nutrition support services. And that's, you know, every dollar that could be going back into our local communities, the pockets of our local farmers and producers. And through our work at HGFA, we've been able to determine, right, that for every dollar invested in our communities, that we could see an almost 5 times multiplier effect in creating and sustaining hundreds of agricultural jobs and thousands of local farms. And then, of course, through the demonstration pilot itself, impacting thousands of Medicaid beneficiaries with increased nutrition security and positive health outcomes for, you know, people right here in our community. But really our focus, our biggest impact we're hoping to have is really guiding this conversation and movement around values-based procurement in institutional markets, and really aligning what we say with Hawaii's values. And so really encouraging healthcare stakeholders to not go with, you know, what's easiest, or not only focused on price, but aligning with our, you know, our social, our cultural values. And like you said, we've seen across the nation with states with 1115 waivers that, you know, Instacart, DoorDash, national organizations with a lot of capital and a lot of power can come in and do the job, but they don't necessarily care about where the food is coming from or the people on the other side who are receiving it. And at HGFA, we care very deeply. And so we want to make this a reality. Just bringing this back again, this is where HGFA stands really ready and excited. We have our framework, right? We have our North Star, we have our anchor in terms of what food as medicine, especially locally sourced food as medicine is and means to us. And Kaʻiulani talked so beautifully about the training and the place-based evaluation components of our ʻAiaola Center. And I'm going to focus now on how we intend to sustain funding for nutrition supports for community-based organizations. And we're really focused on doing that through our community care hub model. And so we know through our work, working with food hubs and small community-based organizations, that HGFA being able to step into this administrative backbone support role. So providing that training and technical support, supporting connecting patients with community-based organizations, the data tracking, the reporting, the reimbursement, and taking all of that on so that community-based organizations, all they have to do is focus on getting the food, right? Getting the food out the door and out into community in the best way possible. And so really trying to streamline connections between healthcare funding, healthcare providers, and community-based organizations. And by serving in this role, we're hoping to enhance system efficiency. So HMSA doesn't need to have 50 contracts, right, with 50 farmers across the state, but they could have one contract with HGFA. And we work with the Hawaii Food Hub Hui, who works with more than 2,000 local farmers across the state, and really trying to enhance that system, that connection. And again, if HGFA is taking on that administrative burden, then community organizations can just work on expanding their capacity, reaching more people, reaching more of our vulnerable communities, advancing health equity. And HGFA in our role have been really able to braid a lot of different sources of funding, whether that's federal, state, or philanthropic, to be able to sustain these services, which up until now have been largely philanthropically funded across the state. What's next? Okay, as I mentioned, it's barely been a month, which is crazy, since the waiver was approved. So the Department of Human Services has to interpret, again, that 230-page document, interpret all of that guidance across all 4 services that they're working on, and then develop their own guidance that they would then give to the 5 health plans that administer Medicaid across the state. And that guidance has to be reviewed by CMS before it can be implemented. And as I mentioned also, they'll be co-developing that process with health plans on how to distribute that $76 million in infrastructure and capacity building funding to CBOs over 5 years. And we appreciate that the Department of Human Services has been very transparent in their phased in implementation of these services. In the last 5-year waiver, DHS works pretty exclusively on housing supports. And so that sector, that service is a little bit more of a better place to roll out. And so in this first year, they're going to focus on housing supports and pre-release coverage while building capacity for nutrition supports to come in about a year or so. But in the meantime, this is our go time. This is our time to plan, to build relationships, to build community, and to build capacity in some of these critical areas that are going to be needed to implement nutrition support services through multiple community-based organizations. So always rooted in Ioane accountability, but also again, creating those relationships, developing that network of cross-sector stakeholders, focusing on contracting and credentialing with health plans, the screening and referral process, again, that capacity building that's needed for community-based organizations, and focused on reimbursement and billing and monitoring and evaluation. Ooh, that's me. And I'm going to turn it over to Jesse to talk about food as medicine in action.
Mahalo, Jordan.
Thank you, Jordan. Good afternoon, everyone. How's my sound? You can hear me okay? Right on. First of all, I'm a little bit of an out-of-the-box thinker. I'm not going to be able to follow the depth of information and research that Jordan has. So I'm just going to share a couple things in a little bit different ways to tell this story from a roots perspective, Kōkua Kalihi Valley and Kalihi perspective, and just kind of my own personal on that. So we can go forward to the next slide. I'm going to start with a poem. Circle, table, pray. To eat well with family fills more than belly. I want to talk about my connection with the work to start with, why I'm here. I've always wanted to do community work. Both of my parents were involved in community-based work and pretty much been doing that my entire life. But I felt like I was kind of in a rut doing that in Kalihi and dealing with so many of the social issues. And I found this need to come back to food, that food could be healing. And that really drove me in a direction where I wasn't exactly sure where I was going to go, but I knew inside of me, you know, that feeling you have in your na'au that this is where I need to go with my life, and was able to start doing this work with Roots and have a lot of gratitude for Ka'iu's role in providing wisdom and guidance for how this really looks from both a culture perspective, also a healthcare system perspective, and then just doing that work together to build a healthier food system. I always tell folks when they want to know about food as medicine and healthy food work that it took a long time to break our food system, and it's going to take work and some mistakes and some learning to rebuild a better system. And I want to start just by asking everybody else to do something similar. Just close your eyes for a minute. All of our friends seen and unseen on the screen here, and think of someone whose food made you feel good as a child. So just kind of honor that person, honor that memory. And when we do that, also think, can you close your eyes and think of a doctor who made you feel good in your childhood memories? It's a little bit harder. So food is actually, you know, our first and most lasting source of medicine and healing. Not that doctors don't have their place or other type of medical care isn't necessary at some times, but food is that constant that brings us back to health. And when we do our work with food, we always start with this Kalihi process that we have, where we do an aloha circle. We gather, we circle up, and we call out 3 names. We call out our name, because we all have a name and we want to share that together. We honor our home, which for some of us is multiple places. And then we bring an ancestor to the circle. And that ancestor kind of circles around us. They hold us up. They give us grounding and strength. And it's that idea of reciprocal care. You know, those people we care for or we did care for who care for us. So when we do that in our circles at KKV, it's not just an exercise, it's a ceremony with a purpose, because our food system should really function in very much the same way. If we have a strong circle of farmers, of fishers, of cooks, of thoughtful purchasers and gatherers around us, then we have a healthy food system. And if that food system honors our ancestors and our family food connections, then it's even more tightly woven together, and it can even move across time. So as we do that work, we really start with this grounding, and you see it in the Hawaii Good Food Alliance, but that really grew out of a lot of work that was done in Kalihi and built off work that was done in Hawaii for generations previously. At KKV, we do have a food as medicine program. We didn't start out calling it that. About 20 years ago, KKV just made the decision that our connection to food, land, and culture needed to be a more essential component of our healthcare. So we've really worked to strengthen that connection to land first. That was our starting point. So some of you may be familiar with ʻAiaola. It's 100 acres in the back of Kalihi Valley. It's a beautiful area that was somewhat degraded by soil mining and ornamental plant growing and things like that, that was reclaimed by the community, leased to the community health center, and becomes that base to have that connection with land. We also want to build food capacity and access while we're doing that. So we want to grow food, learn how to grow food together, learn from our neighbors, have a place where that knowledge is shared horizontally, where food is not something where you have an expert at the top and everybody learns from them. I might learn something from you, you might learn something from me, somebody's going to bring in a lesson from their grandma, somebody else is going to discover something. So want to have that active, vibrant place where food knowledge is shared, that we're aggregating food thoughtfully from people who are doing that with health, and we're distributing that food with love for our community, and we're cooking a lot together. So all of our programs, all of our staff has a component of cooking in their work plan, so we build up that capacity. And then out of that, we can find the ability to create systems. And you brought up the Hawaii Good Food Alliance as an example, starting with just a small community working group, and then realizing there was opportunities to work with other communities. And over time, that grew into a statewide organization that now is international in a sense, and has a really big systematic impact. And it just took time of people working together, building those relationships, struggling over what that really meant to do and how to do that well. And then that final component of food, land, and culture is coming back to those cultural connections. I can't think of a traditional diet that is not healthy. If we're talking about a Native Hawaiian diet, traditionally it's very healthy. If we're talking about traditional Japanese diet or a traditional Palestinian diet, or these indigenous diets, always really grounded in the foods that are around us, the foods that are seasonal, that have balance. They kept people alive. If our ancestors did not have a strong traditional diet, we wouldn't be here today. However, the modern food system is profit healthy above all else. Everything else is secondary. So in some cases, healthy food might be trendy, and certain aspect of the food system may be profitable and healthy, but the overriding message of the food system is make money and do that as efficiently as possible. So we are working within a food system that doesn't necessarily have that same pyramid of values that we're trying to do locally, and there's going to be some back and forth on figuring out how to do that in the world we live in. But I think really food as medicine is a place where this can all come together. We can uplift traditional and cultural foods. We could develop a more sustainable, healthier food system as we do this. And then as Jordan was talking about with the 1115 waiver and programs like that, there's a real opportunity to redistribute resources from the healthcare system, the insurance system, government, even retail economies to improve health. And in that way, we benefit on multiple levels. People's health benefits when they're involved in a food as medicine program. Oftentimes they're sharing that food with their family or thinking about how to feed their family a little bit different when they're getting more healthy food into their household, so that can extend to family health. if we're doing this in a way that's very thoughtful and mindful of how we support our local farmers and food producers, then we're strengthening them economically, and we're building new generations of folks who can continue to feed us. And then we're also strengthening these community-oriented providers, organizations that really care about the folks in their communities, have the connections. Those are the folks who work there. You know, those are their families, those are their neighbors, and we want to strengthen them so that some of this huge insurance and food system economy is really building up communities like Kalihi. KKV and Jordan, you can skip ahead. Let's look forward a little bit. Yeah, you can stop there. I'll talk a little bit about one example of what we do because it encompasses several of these elements of food as medicine. So we have an Ipono pilot program with Aloha Care, which is a low-income insurer here in Hawaii. And this program began prior to the 1115 waiver getting approved. So we're doing this kind of on a smaller scale, initially with the anticipation that we may have this waiver and we may be able to do it on a larger scale. And we wanted to learn some lessons, develop some wise practice as we go and just model the things that are our foundations as a program. So as you see those kind of concentric circles on the slide, Ipono's in the center. On the outside is wellness and well-being. We really want to make sure that everything we do at Ipono is true to that. You know, the interaction with the participant contributes to their well-being. The farmer is growing food thoughtfully. They're not poisoning the soil. They're not poisoning the vine. They're have a healthy approach to how they grow food and work with their farm workers. That there's an element of coordination and connection that goes into this. We can't do this alone. We can't grow enough food in our program to feed all of Kalihi. We understand we have limitations, but farmers also have limitations too. You know, when we first started our program, we were creating farmers markets in Kalihi. And after a few years of talking to farmers, we realized it took a lot of energy and time and resources for the farmers to leave the farm, come to town, set up farmers markets, sell that food, get their reimbursements, things like that. It meant a lot less time that they could actually grow food. So we creating distribution networks, aggregation networks. Right now we're working with some of the food pantry, Aloha Harvest, some other folks who have bases in Kalihi to think about how we can work together on the storage of food so more of that local food can be safely stored in Kalihi. And all that goes into our food hub sourcing. So we're able to kind of create somewhat of a closed loop food system in Kalihi where we import as a state, up close to 90% of our food, but we're able to create the meals with this Ipono program to send the boxes out that's 90 to 100% local food products. So what exactly is it? You can go to the next slide, but it's not really on that slide. I'm going to pull up a different slide of mine. Yeah, that's not in there. So what we're tracking with our Ipono program is we're gathering some data. We're giving 2 meals a week to participants. These are what we consider to be our Ipono meal, which is grounded in what a traditional healthy meal might be in Hawaii hundreds of years ago, but adapted a little bit to where our community of farmers and food producers are at now. So we try to do a lot of fish, local meats. We work only with those traditional nutrient-dense carbohydrates and starches. So kalo, ulu, uala, banana, cassava sometimes. Those become kind of the base of it. And then we also work with seasonal vegetables for the most part. Since these meals are being prepared and chilled and then sent out into the community, we learn pretty quickly that things like salad and cut fruit is not going to be the best way to do this. Those things are going to sit in people's refrigerator for a little while, but something that people can easily warm up, that's comforting, that brings those traditional foods back into their diet is really the way to go for us. So we do that. We send a produce bag or box out to each family, which is all sourced from local folks, farmers. So that goes into their ice box on their counter. They have those local foods, healthy foods available. And then we do a nutrition consult with each participant, usually in small groups, so it's not too intrusive and it's not like a whole list of questions going to one person, but we have that conversation about nutrition and how that's evolving. We're also seeking some funding to expand that research and do some quantitative study as well with that, looking at ways that we can do that again is minimally invasive, because we don't want the process of being part of a pilot to be something we're extracting a lot of information out of our community members. We want that to be something that's healing as well. Some of the challenges we have to doing this is transportation, people just getting to pick up the food and working that into their daily lives and getting the boxes. So we work with partners as much as possible, work with our elder program right now so that there's a place where people are gathering and we can get the food to them at that place. Another component that I didn't mention earlier is that we do an ʻAina engagement every month as part of the program. So people are not just eating the healthy food, but they're also spending time on the land where food is grown, whether they're doing some gardening or taking a walk outside or, you know, making lei, doing something that they're reconnecting with food, they're having that in their life. And we want to track how that's impacting people's health as well. Just a little aside, at the ʻAiaola last week, I was talking to one of the other participants and talking about like what some of the barriers are. And he was saying, you know, one thing we don't talk about is we talk about these concepts historically is that Hawaiian society was very highly evolved and capable and had these systems in part because they had time. They had more time than we have now, that their food system was very abundant and people didn't have to spend a huge amount of time getting the resources together to get food or to grow the food. It could be part of their day and they could have time to do other things. And that's how the system really evolved in a lot of different ways, artistically, culturally, religiously. So I think one thing we deal with is like folks in Kalihi often, you know, they're working a lot, may have 2 jobs, may have 3 jobs, they may have kids, they may have caregiving responsibilities. So that's been a challenge. How do you work with people that are also juggling a lot and don't have a lot of time? And having the acceptance that this is not a complete feeding program. We're not putting every meal on everybody's plate. We're more consistently modeling a culturally informed way to eat healthy and connect with the food that's grown locally, and make sure we do that in a way that people can meet us somewhat where they're at, where we can give a good model, but at the same time, people are going to eat what they're going to eat to a degree. And I think studies have shown that if you introduce these traditional healthy foods and make them accessible into people's diets, that people will go in that direction. And it's not about that they 100% follow that or they don't eat some of these less healthier foods. But if this is part of their life and it's accessible, people will move in that direction. So that's kind of like a twist. As you in the healthcare field, we talk about behavioral health change, and that's a way that was used in the past that somewhat shames people for how they eat. And we're moving away from that, but we are changing health behaviors. I think we just have a different approach to how we're doing it. And then just some of the values, we want to ensure that the work we're doing is true to building the healthy food system we want. Like saying like we could do this more efficiently probably through Costco, but it wouldn't support the local economy. It wouldn't create another generation of healthy food producers. It wouldn't heal the ʻAina. It's not really the way we want to go. So that's our approach. And it's one that evolved in Kalihi. I think in other communities or other organizations or programs, you know, with different resources or different needs for their community, that their food is medicine program or their food access program may develop a little bit differently or have some different goals. And we just learn from each other through that. Jordan, I think I might have one more slide. This is my house. I'm gonna end with another poem. Okay, you asked me to end with a poem. I think I got like 3 minutes. And for me, you know, Kaʻiu's all these things. She's kumuhula, lomi lomi practitioner, mom, all that. You know, one thing we always talk about our program is to identify your gifts, become your best self, and share those things, because we're growing together as a community, we're growing together as family units, and we're also trying to become healthier as individuals. So one of the things I've always done, and part of my family tradition, is to write poetry. So I got a little food poem I'm going to end with. It is the last day of June. The trades are back. My day begins with a work transaction at the farmer's market, which leads to a personal transaction with a farmer friend, which leads to 20 bucks being exchanged for a giant bag of mangoes. It is mango season, and this is my one-day story. I leave work to run an errand. The mangoes ride next to me on the car floor. I have a stop at the most god-awful place in the world, the mall. When I come back, my soul 5 pounds heavier. The mangoes have warmed the car has warmed the mangoes. It is the last day of June. The trade's back, the freeway crowded. I concoct mango dishes in traffic. Mango ginger white wine sauce with chicken. A mango and butter poached fish. Honey mango roasted carrots. I get home hungry. Wash the mangoes from the bag, place them next to the green common ones picked from the yard. It is the last day of June. School is out. My daughter brings me a green smoothie. The ice not quite blended, but it's good. Her secret ingredient, mango and ginger. It is 3 in the afternoon. Hot sun bullies the wind, but the smoothie has energized me. Our mango tree is shedding summer weight in fruit. The neighbor leans over the yard, says, "Oh, looks like one mango graveyard." I put on gloves and grab a bucket, pick up, carry, and bury a good 280 rotting mangoes. The soil and all its creepy, crawly subterranean friends thank me as the sun sets over Kalihi. I slice mango into flowers to devour, sticky juice dripping down chin, the fragrance perfumes the night wind. Food is something that's within all of us. We all have this connection to it. We all have the capacity to heal and get better. And I think this is a challenging time for a lot of folks, but food can be that happy and healing place. And thank you for your time. Thank you for the organization, everybody, as well.
Mahalo, Jesse. Yeah, and mahalo, Kaʻiulani and Jordan, and all of our guests. I just wanted to address, I'm not sure if everyone saw this, but we had a great question from Zeni. Aloha, Zeni. It's nice to see you in here. Asking about these services being available for our veteran community, and Kaʻiu answered that the VA received several grants for this to do produce boxes and things like that. There might be some limitations, so you can kind of inquire within your local VA system. I know there's care in the community projects through the VA as well that you can see outside providers, so that might be a source or an avenue. And Kaʻiu just added that any veteran that lives in the 96819, lives in Kalihi, would be eligible for the KKV services. So I hope that's a good piece of information. We have about 1 minute left, so I would encourage anybody. I put a ton of information in the chat. There's also a great webinar taking place tomorrow, sort of a brown bag, from Shad Marvasti, medical doctor, discussing food as medicine. So yeah, I think we can end it right there. And I just wanted to thank everybody again. This has been such a just hugely informative event, and I always appreciate the time everyone takes to do this. I'm sorry you weren't feeling very well, Kaʻiu, and I just appreciate that you toughed it out and showed up and shared this wealth of knowledge with everybody. We're very grateful. We have post-secondary food systems education webinar March 5th next month, and then we're talking about food hubs April 16th. So I'll send this video out to everybody who registered, even if they couldn't make it, so they can see everything that we discussed and everything that was taking place here today. And again, just mahalo everyone for attending. I appreciate you so much.
Mahalo, Ioane. Thanks for having us.
Hello.
Thank you for having us.
Ahuiho.